All right, welcome, and can everyone please rise to salute the flag? Allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So good evening and welcome to the October meeting of the Revere Board of Health. My name is Dr. Drew Bunker and I am the chair of the Board of Health. Joining me for tonight's meetings are board member Dr. Craig Costanza and Neza Luadi. In attendance also for tonight's meeting, our City of Revere staff Lauren Buck, who's Director of Public Health, Michael Wells, Director of Municipal Inspections and Health Agent, Paula Supulvida, Board of Health Clerk, and Claire Inzarillo, policy writer and analyst. Tonight's agenda is first, we will review and approve the minutes from September 22nd meeting, 2022. So I'm just going to approve the minutes, and if everyone else on the board agrees and approves.
Yeah, I approve the meetings at the hours.
I approve as well.
Great, excellent. Next, we're going to do the Public Health Communicable Monthly Report by Lauren Buck.
Thank you. So for October 2022, I just want to draw your attention to the fact that we have had 6 confirmed influenza cases. Obviously, we're entering flu season. Our age range is 3 to 80, which is pretty standard. Flu affects very young, very old, so we'll keep our eye on that, but we expect those numbers to continue to rise. Also, I wanted to bring your attention that we have had 2 confirmed cases of legionellosis, ages 50 to 79, and that's something that we always keep our eye on as well. Okay, other important notes. The Uganda Ministry of Health announced the first positive case of the Ebola virus disease in Uganda in 2022, which was caused by the Sudan virus species on September 20th. At this time, there are no confirmed cases of Ebola virus disease related to this outbreak reported in the United States or other countries outside Uganda. And the current geographic scope of this outbreak in Uganda is small. The U.S. is already starting to work on this, though. Efforts include entry screening for U.S.-bound travelers from Uganda, building local response capacity in Uganda, and accelerating the development of an Ebola vaccine and treatment. Just so you also are aware, local public health does have a role if any suspected if any cases who had recent travel to Uganda are in Revere, we do follow up with them regularly. Also, to let you know, Black, Hispanic, and American Indian, Alaska Native adults, a report from the CDC. So Black, Hispanic, American Indian, Alaska Native adults in the U.S. are more likely to be hospitalized with flu, as well as less likely to be vaccinated against flu, according to a new CDC vital signs report. Flu vaccination coverage has been consistently lower among Black, Hispanic, American Indian, Alaska Native adults since 2010. Compared to white adults, hospitalization rates were nearly 80% higher among Black adults, 30% higher among American Indian, Alaska Native, and 20% higher among Hispanic adults. And just as a side note, it's really important that everyone gets a flu shot. And to help prevent against significant disease from flu, we do offer them here in Revere. Most CVS's, Walgreens, most pharmacies have them as well. Our COVID monthly report, as of October 24th, we have had 25,336 cases, confirmed and probable cases of COVID. Our daily average case count is 6.4. Our 14-day positivity rate is 7.9. This is slightly decreased from the previous month's rates, which is good. And our total number of deceased from COVID is 192. And lastly, just an update about our vaccination status. As of the 17th, October 17th, out of Revere's total population, 90% have received a first dose of a COVID vaccine and 77.4% have been fully vaccinated, which means they've had at least 2 doses of the mRNA, which is the Moderna Pfizer, or the single dose of the J&J, or the other vaccine, the Novavax vaccine. Those numbers are slightly lower than the state average, but very, very close to being right on track with the state average. And also we continue to have COVID vaccine clinics every week in Revere as well. You can always look on our website. And that's it.
Great, thank you, Lauren. Next is going to be the Inspectional Services Monthly Report with Michael Wells.
Thanks, Dr. Bunker. So for October, the municipal inspections stat report is as follows. On the Interior Housing Division, we issued 97 certificates of fitness. Number's a little bit higher this month as we had a new project receive their certificate of occupancy. And then inspections were done on those units. We had 19 re-inspections on certificate of fitness. We had 23 interior complaints submitted. We had 7 interior complaint re-inspections. We had 2 pool inspections. We had 2 lodging house inspections as well. Moving to the food inspection division, we had 48 routine inspections. That includes, in the month of October, the Revere Public Schools cafeterias were inspected. We had a total of 4 re-inspections, 2 complaint inspections, total of 5 pre-opening inspections on new establishments, and a total of 3 temporary food service inspections, which are 1-day licenses. On the exterior sanitation division, we issued a total of 472 violations in accordance with our trash ordinance. We had 3 violations issued for improper signage on public property. We had 3 improper storage of garbage, 13 improper storage of garbage and trash. 13 violations issued for junk heaps or improperly parked motor vehicles on properties. We had 1 rodent complaint and 13 unclean, unsanitary violations issued. That's in accordance with our overgrowth regulations, and we'll see those, we already have seen those decline as we move into the fall months. And that concludes our report.
Great, thank you, Michael. Next part is going to be reviewing the draft of the biosafety regulations. And tonight we have Claire Inzarrillo. I'm sorry if I'm pronouncing your last name wrong.
No, you're good. I say Inzarillo, but everybody says it their own way. So basically what we have from the solicitor's office is our draft on the regulations on biosafety and the use of regulated biological agents. For some quick background, most of it has been inspired by Peabody, Bedford, Beverly, with Boston and Cambridge serving as kind of the overarching models because they obviously have a lot more experience than the smaller communities. You'll see the highlighted portions are kind of, for me, what I wanted your input on most. I left some things up to you guys' discretion, such as the fee and violation amounts, stuff like that. Any and all of this is subject to change, whatever you guys think is most fit. But we can start. I don't know if you have the attachment, but you can see already in our zoning regulations, we already have the animal testing prohibited, and we already have the statement of declaration that shows that biosafety level 1 and biosafety level 2 are the only ones we're going to allow. We will not allow 3 and 4. So those already put in the Suffolk Downs overlay district. So we didn't see a need to reiterate any of it in the regulations because these regulations are mostly for interior compliance and not what has to do with the property and all of that stuff. So I will start. Unless any of you feel strongly about the purpose section, that's more of just kind of a preemptive sort of thing we have to put in there.
Claire, I'm just going to jump in, and maybe we can explain, if you can all look at your section B, the last line that's highlighted. Maybe we can talk a little bit about the decision-making to put that in.
Yes, so the exact language is pretty much from the City of Beverly's exemption section. When I was speaking with Lauren and some other folks, we wanted to make sure that, primary care facilities, MGH, Cambridge Health Alliance, they wouldn't suddenly be thrown into the spotlight and have to come up to speed with these regulations that don't necessarily apply to them. So the reason why we included this in, for the purpose of this regulation, research or manufacturing will not include clinical or healthcare services or professional analytical services that directly support clinical or healthcare services. Very wordy, but we wanted to make sure, especially with like all the vaccine clinics that we're having, Quest Diagnostics, places like that, we wanted to make sure they wouldn't be subject to, applying for this permit every single year and things of that nature. Any questions for that part? Okay. And then in all ordinances, we have a definition section. This part's pretty basic, as you can see in D for the definition of a laboratory. We have the basic definition, and then what we've added in at the end for the exemption, we have the exclusions. We have classroom laboratories, dark rooms, pharmacies, drugstores, direct care healthcare providers, facilities providing medication. This section's taken directly from the City of Boston's ordinance, where they have a registration of labs section. And this is, again, making sure we protect the pre-existing primary healthcare facilities. Or if, a Revere High School student was doing a science experiment, they wouldn't have to do this whole process. All right, and then some things that I had to research a lot that you all may be unfamiliar with as well. If you look at F in that same section, we have the definition of what a regulated biological agent is. It's a lot of scientific language in there. This is a federally written definition. This is the National Institutes of Health. One part that I was confused on was Part F, Section B, where it says regulated biological agents classified as a risk group 3 through 4. That might sound like, secret weapon technology, something very fancy, but it's really just, those pathogens or infectious diseases that labs are like searching for treatments and cures for. So this just covers that. And make sure that they're following by federal guidelines if they're dealing with any of those combinations, pretty much. And then the rest of the definitions are pretty straightforward. It defines all of the manuals that are referenced. It defines the Institutional Biosafety Committee, which most of these companies and labs are familiar with because they're federally mandated to have one. The last highlighted section in the definitions part is for what a select agent is. That is, again, federal and state regulations define what a select agent is. And you'll see highlighted, select agent shall not include any de minimis amount of agents or toxins which are included from Code Federal Regulation Chapter 73. This basically just means that anything that these labs are working on, the de minimis, that Latin phrase, just means really, really small amount, so small that the law does not apply. So this kind of covers any loophole, pretty much saying, even if you had the tracest amount of some agent, this definition includes that. So whatever's not listed by federal regulations, you can't use it. So if something new was discovered that's not federally regulated by the NIH guidelines, even if this lab wanted to sneak in like the tracest, tiniest amount, this would protect it from being used.
Does that mean that they wouldn't be able to do that?
Right, so select agent shall not include even the smallest amount of any agent or toxin that's excluded from the list that the federal government provides. I had to work through that one. So that's it for the definitions. Were there any clarifications on any of those? It's kind of the boring part. So institutional governance, this is perhaps the lengthiest part of most city and towns regulations. It goes over any institute that is seeking the permit from the Board of Health must have a institutional biosafety committee. The biggest point of contention when my office was researching was some larger cities that have a lot of life science development. They have an institutional biosafety committee, which the company itself has at the site, and they would also have a municipal biosafety committee. So it was up in the air, does Revere need one? But for now, we've come to the conclusion that we only see one or two in the foreseeable future. We wouldn't need a second redundant committee checking the same exact thing. All these institutes are going to be going through the Board of Health anyways. So federally required institutional biosafety committee, we see that as the best fit for Revere right now and in the future. If life science expansion boomed in the city, we could add another committee if needed. But This committee is set up by the institution itself. As you can see in A, what Lauren and I came to the decision was it will include representatives of the institution, that's federally required. And then we came up with it will include the Director of Public Health of the City of Revere or their designee. We know you guys' time commitment to the board is strained. You all have full-time jobs. So some cities have a Board of Health representative. Some cities have the Director of Health and Human Services. We thought it best for this department's representative, this board's representative, to be the Director of Public Health or someone she chooses. Also federally mandated is a community representative. This is someone from the City of Revere who is a subject matter expert. You can imagine that may be difficult to find, which is why we've put in that the institution has to find this person, not the Board of Health or the city. And you guys would have to approve that person as well. There's a federal minimum of 5 people on this board, but most institutions have much more than that because they pick employees from all different departments.
I have a quick question here. First of all, if the board decides that the representative you want the representative from the city to come from the Board of Health, that's totally fine. We can change that. I also wanted to ask Claire, for the community representative, did you see in any regulations or do you think it's important that we specify that community representative cannot work for the city, or do you think that doesn't matter? Did you see that in any regs?
It was not written anywhere I've seen. Most of them are very specific that they live in Revere or in the city. Some of them are less specific and it's works around or is around the city. So if we had to, broaden the definition, if we're having trouble finding someone, we can definitely do that.
Okay, great, thank you.
The IBC shall meet no less than once a year. That's federally required. All minutes are forwarded to the Board of Health. So you guys, anytime they meet, you guys will see that. It's also federally required. If any person of the public wanted those minutes, they can have them. C is pretty much regular in every ordinance. You can't have any financial interests, NDAs, all that stuff. D is pretty much all federal regulation. They have to review and approve all their work that involves recombinant DNA. Again, from what I've heard from Cambridge and other cities is that these companies and these labs are very pro-compliance. They never want to mess up. They're very eager to comply. So pretty much everything that these cities put out in their regulations, it's almost all federally required in the first place. So they know all of this. They know that, their biosafety officer has to approve their projects. They know that they have to have descriptions of every project, what level of safety it's used, stuff like that. And all of these reports that they're going to be submitting to their institutional biosafety gets filed with the Board of Health. So you guys will always have access to see what's going on. E is more just demographic, knowing who's on that board, names, addresses, resumes. So you guys will always know who's over there if you needed to contact someone. And then the other chunky part is the permit requirements.
Can I ask one question
Yes.
about institutional governance
Yes.
before we move on? For section B, for all minutes that shall be forwarded to the Board of Health, is it necessary to specify within a certain amount of days, or is that overly regulated? Do you know what I'm saying?
From what I know, they rarely meet. So I would assume it wouldn't be a problem getting them, but we can definitely put in, within 30 days of a meeting to forward those minutes.
And that's just one thing for the board to know. So Claire and I, she's done a lot of research, and it seems like for the most part that these institutional committees, most regulations and federal regulations state that they have to meet at least once a year. So there is no requirement to meet more than that in most regulations.
Right.
In all regulations, really, that we've looked at.
Right. Okay. We can move on to permit requirements. I can tell you exactly which ones are federally regulated, and I can tell you which ones are just, used commonly. So They will submit their application to the Board of Health with a fee that you guys can debate on after. The first couple are pretty basic: company name, address, date of incorporation. The fourth one, that's federally required, the institution's designated official responsible for compliance. They have, it's called different things in different places: biosafety compliance officer, principal officer, stuff like that. Number 5 is also federally required. We know their biosafety levels are going to be 1 and 2, but they have to label, all their labs, all their experiments. And that is, you can see this designation should be reflected in the minutes before work commences, or no more than 30 days after that work commences. Number 6 is something you guys will also have to think about. They would have to provide to the Board of Health a detailed table in a format provided by the Board of Health, a listing of all organisms, the source of the organism, whether the organism is used in, certain type of experiment, decontamination procedures. I've taken a look at either Beverly or Bedford. I looked at they have a municipal biosafety committee, and I checked their minutes, and they were going over one of these tables from a company that was asking for a permit. And it's literally just an Excel spreadsheet with like 3 columns that says organism, type of experiment. So pretty simple. So that's submitted. Number 7 is another kind of just record keeping, showing that they have strain verification. This is all kind of the science part of the application. So that would be submitted. Number 8 is federally required, a biosafety manual. They probably already have one if they're already, up and operating, but that gets approved by you guys, and you have one on hand in case, emergencies, spills, accidents. That goes in line with number 9, also federally required, an emergency response plan that would go to the Board of Health, Fire Department, Police Department, DPW, stuff like that. And that would include floor plans, waste storage. That's federally required, so they probably would already have that. 10 is a little finicky. It's federally required. It's the medical surveillance agreement. Before this, I worked at Dana-Farber in Boston, and we had occupational health services for the 20 times I had COVID. I was always submitting my symptoms to them, so they would have to have a situation like that with either an in-house clinical resource or like subcontract that out to a third party for employee sickness monitoring. And it's just, stipulations. If X number of employees showing the same symptoms, you'd have to report it to the Board of Health, stuff like that. Again, this is federally required, so most, if not all, labs would be aware of this requirement. Number 11, this is a state requirement. Plan for treatment and management of all biological waste, and that's in the CMR. That's kind of just, I have it attached if anybody wants to read it, but it's, sharps and needle disposal, decontamination, stuff like that. 12, again, everyone has this. It's just treatment or monitoring plan for systematic pest control management, stuff like that. 13, that is the more relevant one, written authorization to allow inspection of facilities by the Board of Health. So Board of Health inspections, they would be able to go in there. B, you guys again would have to decide on this, how long you want to have to decide on a permit. We have in here, I just put it in as a placeholder, the Board of Health shall take final action within 45 days. We can change that, if it's winter time and we have holidays and you guys don't meet for a month or 2 months, we could have the wording in to say, the Board of Health shall take final action on the permit application, within the subsequent Board of Health meeting or 2 Board of Health meetings, whatever you guys think is best. I can't imagine an influx of applications anytime soon, but.
Yeah, I can imagine that we'd want at least 60 days just to cover us for 2 months worth of meetings potentially. And I just have a question about that. So potentially a company submits an application to us, and they, in terms of timeline, they have to come before the board and present all of the stuff that we're asking them for. And then we can the board can listen to that at that meeting and then make a decision at the next meeting, correct?
Yep.
Okay, so in that case, I think at least 60 days would probably be advisable.
Yep. We could put in 60. And again, with that 60 days that you guys have to decide, when they start out, they don't have to say, oh, we've already had our institutional biosafety committee meet. They can say, oh, we're meeting in, 2 weeks, when they cut the ribbon or whatever. So they also have time to get their stuff up and running as well. And you can also, in here, we put a stipulation that you guys can extend that time, say, there's a hiccup in the application, they need to fix something, you want more information regarding something, you and the institution can come to the agreement, okay, we're gonna push this out a little longer. That's in there as well. The fee for the permit application, that's something you guys can decide on. I put in a chart of, not neighboring communities, but other communities that have labs in them, what they charge. Seems like they just pick as they feel. There's not really any guidelines on how they want to charge it, but in terms of violations, again, they're very compliant. So the city of Boston, you can see, charges $1,000 for a violation. For permit applications, they have a sliding scale based on how big their lab is, what kind of stuff they're working on. So definitely keep that in mind when you guys are thinking about what you'd want to charge for the permit, and it would be the annual renewal as well for that permit.
And I just say, so in terms of timeline for this, again, we'd be having a public hearing on the draft of these regulations in December. So we would need to have a number inserted at that time that if, that we can use for the public hearing. Yeah.
And then the D is more, inspections. If they were to close or move, they have to provide a decommissioning report, show that everything was properly disposed of, stuff like that. Inspection and review. For A, something that we added in that was a bit different from other cities is we're going to allow unannounced inspections. We thought it best to not be constrained by a timeline, Some cities have in that they will put in a 2-week notice. Some cities have in that they have a 30-day period when they can come in. We thought it best to be vague. And again, they're all very compliant, and I don't foresee a problem with having unannounced inspections. Yes,
What is the requirement of the number of inspections per year?
there is no requirement.
Really?
But could we put that
Yeah.
into our regulations?
Mhm.
What do you think about that, Mike?
They do the opening inspection and the closing inspection, and then for the permit renewal, there's not really language in for a required inspection, but we can put one in.
Okay.
What would you think in terms of?
I would recommend at least twice a year
Yeah.
at a minimum.
Yeah, that can definitely put in. Related to that, we have that the
And then a
board.
re-inspection if needed,
Yes.
then the re-inspection is announced.
Yep.
They know you're coming back.
Yeah, and then later on, there's a part if the Board of Health has to revoke the permit for some sort of reason, they would be able to do so. Yes, we can definitely put in the required inspections. It also allows for, every city has this, that the Board of Health can retain an independent consultant, not from the city of Revere, they can be anywhere, and the institution would pay for them. If something happened and a specialist needed to come in, that would be paid for by the institution. If anyone was wondering, some cities have a designated fund, for biosafety. If they seem to be dipping into this fund a lot to have special people come in. I spoke to Rich Viscay. He doesn't think, along with the solicitor's office, that we need a fund at the moment to hold, all this money, because we don't think we're gonna have that many problems in the beginning. But he said it'd be very easy to put in a revolving fund in the future. If the bio lab development kind of expanded, we could set up a fund and have money sitting in there if we needed to call all these people in to check on these places. Again, confidentiality for proprietary information. This is D is pretty standard throughout all cities. The institution shall report within 24 hours to the Director of Public Health any significant accident or risk of illness released to the environment. And then they would have to write it up to you guys within 15 days. We can change that time frame if you guys wanted, but that's pretty standard amount of time. And it says here at the end of D, an additional inspection of facilities and procedures may be deemed necessary by the Board of Health based upon its judgment of the nature and extent of the problem. And restrictions, again, we didn't want to reiterate the animal testing because we want to stay out of that as much as possible, but it's already in the zoning ordinances. So in restrictions, we kind of just reiterated no 3 and 4 for the biosafety levels, and any experiments for which containment levels are not prescribed in the guidelines, and the guidelines are the federally required NIH guidelines. They have to essentially be reviewed and then given a risk assessment, and then the IBC would let the Board of Health know. So it's kind of saying whatever's not covered would have to be covered. Penalties and violations, again, this is up to the Board of Health discretion. Every other ordinance that I've seen, they charge per day per violation. So you can see it ranges from 100, 200, 500 is pretty common as well. Each day a violation shall constitute a separate and distinct offense. And again, Lauren told me that the Board of Health hasn't had too many speed bumps in terms of issuing violations. Everything seems pretty compliant, so we would be able to hand these companies violations if needed. But again, they're very compliant. So keep that in mind on what you guys think is best for a fee. Again, here, this probably relates more to Mike, but for B, if, in the opinion of the Board of Health, the use of regulated biological agents causes a nuisance or adversely affects public health, safety, and welfare, the permit can be revoked. And then after due notice and hearing, if the institution has materially failed to comply, we can keep it revoked or reinstate after another inspection. And then the last part of that is D. This is pretty much if any institution or person had, a problem with the decision of the Board of Health, there is an appeals process. They have to write it in within 10 days of the action or incident. And then the Board of Health sets a time and place for a hearing no later than 30 days. Again, that's a placeholder. We can extend that timeline. Again, these labs are very compliant. I don't see any appeals coming in, but if you had to, we can make that a little longer, 60 days if you wanted. But again, final decision is always going to be the Board of Health. And then the very end, this is more of a legal section for the variances. So if any institution wanted to apply for an exception to anything written in these regulations, they can apply for a variance. And all they would have to do is prove that with the exception, they're still following the protection that's offered by these guidelines. And then the Board of Health could issue a variance, which would have to be displayed for the duration of the variance. But again, most of this is federally required. So unless they were testing on something really crazy, I wouldn't see them applying for a variance. But we put it in to cover ourselves legally. You guys already have the fee chart. The zoning ordinance covers the biosafety levels 1 and 2 and the animal testing restrictions. And then we already had HYM, the investment group that's going into Suffolk Downs. They've already had a letter it was in August, agreeing to all of this since we didn't have it yet. So they've already agreed to the no animal testing, biosafety levels 1 and 2. We just didn't have this yet, but they've already signed off on being compliant.
Thank you so much, Claire. That was great.
Awesome.
Any questions?
No, thank you.
I just have a question, actually. For the clinics that are already in place, is there anything, if they were to do research, like what Would these apply to this at all?
They would have to be doing recombinant DNA research, which is, I've struggled to understand with, but it's basically any institution, and by institution it would include primary care facilities and stuff like that. Anyone who touches our DNA has to follow the federally required NIH guidelines, so they would be subject to all of this pretty much. But not even, if we didn't even have the ordinance, they
Okay.
would have to follow it.
Okay.
Do you envision that, are you talking about like potentially at a primary care, like a research project?
No, yeah, I just was wondering if, what were to happen if a medically affiliated clinic or, some institution were to want to do research, would they then have to follow under these?
We've been grappling with that as well. They may, it's why we stuck in the variances at the end, but we're trying to figure out what that would include.
Yeah, I think that's a kind of a gray area. I'm not sure if we know
'Cause
potentially.
It also depends on the type of research, like what agents they're actually touching. Because if they're not using like synthetic DNA and like human gene sequencing and all that stuff, then they can keep that on the side, pretty much. It's very specific to the rDNA recombinant stuff that the life sciences are doing, from what I understand. Yeah, we're still investigating. Great, thank you.
Great. I think that's it. Thank you, everyone. And we will see you in 2 months. Thanks.